Will Smith right there. Here to talk more about brain injury and what this could mean if your child is playing the field for the first time or maybe thinks they have some of the symptoms. You need to know about this. It's local doctor Karen Swarts. Karen, thanks for being here. It's great to have you here on More. We just watched a clip there from the movie. Do you think the movie has done its part in spreading out the information that CTE is a big problem, and even parents with kids playing youth sports, you got to be aware of it, you got to be looking out for these signs and symptoms?
I think it has, in the fact that it makes sure that people are more aware of what a concussion is. A lot of kids have actually had concussions, but they don't realize it. Basically, education is really, it's only now coming about.
Yeah, because back when I played sports, and you two, you're saying you used to play soccer, back then it was getting your bell rung. No, that was actually probably a concussion. It can lead to long-term effects and damage. What's prompting the problem nowadays? Is it just people not knowing enough about it and continuing to get the word out? Yeah,
a lot of it is that. The other part is athletes themselves, they are trained to just push through. They don't want to not play. They don't want to disappoint the coaches or their parents or whoever's really pushing them.
That's very true.
So letting them know what the serious consequences can be is also part of that education.
Okay, so let's say you've got a kid playing football. So it could be any sport, really. It's not just football. Football gets a lot of the attention. Cheerleaders get a lot of concussions as well. What are some of the signs and symptoms parents out there need to be looking out for?
If there's any loss of consciousness, that's a concussion. If there's, like, they feel dizzy or not quite themselves, if basically they're dazed, or really if they're confused about what just happened in the game, those are signs of concussion.
I've also heard like sensitivity to light, stuff like that.
Yep, headaches are a big one.
Headaches are a big one.
Yep.
Okay, so what are the things that you can do and other doctors out there are doing to help treat this?
A lot of it is to help educate, one, but what you want them to do is to have rest, school and sports for probably a day or two, just to make sure those symptoms are gone. Then there's a stepwise approach that we do use, and you want to basically follow up each step. If their symptoms return, you basically go back to the step before.
So the first one, get them off the field, rest.
Exactly.
Then light aerobic exercises, just kind of easing back into things. Sports-specific exercises, obviously football, you're not going to want to just strap on the helmet again and get back out there. So how long is the typical process? And I know it's different from kid to kid and person to person, but on average, if you do get a concussion, how long do you typically need to rest before you can then participate again?
Really, since it's a 6-step process, it could be up to 6 days. Would really minimum of about a week, but overall it depends on the child and their symptoms, because like I said, if their symptoms return, you have to kind of back off.
You know, the NFL has kind of become the poster child for this cause, for good reason. Do you think they are now doing enough to get the message out there and to set a better example for kids that, look, you don't have to be the tough kid, you don't have to be the tough guy. If you're hurting, say something?
For the most part, they're trying, I think, but I don't know if it's actually enough. Because we still have that culture of push through, you know, work through the pain, all that type of stuff. There are plenty of college athletes out there that, you know, they're looking at, can I go pro? Can I do all this other stuff? And, you know, that's not exactly the best message for the younger kids. You know, they need to really take care of their brain.
All right, well, hopefully we're going to start making better progress on this, because it is becoming a big problem. Dr. Karen Swarts, thanks for coming in.
Thank you.
Monica.
All right, and David, it was pretty exciting to know that the doctor was coming on, but Dave actually interviewed the doctor that Will Smith plays in the movie, and he is a very passionate person, very compelling interview. So hopefully a lot of parents are taking heed to his message. All right.